Okay, so now what I'm going to show is the process of once you have mixed your Remodulin cassette, you've attached your extension tubing, and you're ready to attach and program your pump. So the first thing that you're going to do is you are going to press and hold the on-off button. Now remember, the batteries in this pump get switched once a week. So to do that, you would just slide that back, and it is AA batteries. When you do that, it also turns on the pump. So I've just turned on the pump. It's going to perform some self-tests. Once you hear it sing a little song and get to the stop screen, that's when you know it is ready to be programmed. And again, so this is our cassette. We filled out our label, and we have attached our extension tubing. So I'm just going to wait for that to perform its self-test. Okay, so I am to the stop screen. I would have my dosing guide here so I could confirm the correct dose. I have it here on our cassette. Our dose today is 12. Our rate is 37, and that's over 24 hours. Our concentration is 0.04. Today's date is 12/6. It is 12 p.m. And we use 2 mLs of a 1 milligram per milliliter concentration vial. So to program my pump, I'm going to press the next key. Reservoir volume with a new cassette should always be 100. To reset that, I'm going to press enter clear. That will reset it to 100. That's a constant. Now I'm going to press the next key, continuous rate. So this is the only time we use the arrows in this process, and according to our dosing guide in our cassette on our label cassette is 37. So I need to use those arrows to move it to 37, and I'm going to press enter clear to save that. Now I'm going to press next. The given amount should always be 0, so I'm going to press enter clear to reset that. We haven't received any of this cassette. Now I'm going to press the next key 3 times to get back to our main screen. And I usually suggest that we just review those settings to make sure that they all went through and were saved. So to do that, I'm just going to continue to press the next key, 100, correct. Our continuous rate, 37, that's correct. Given, we haven't received any. And these are the prompts programming. Now we're back to the stopped key. So I'm going to either use a coin, you can use your knife, anything at all, and I'm going to move that clockwise and remove the protective cover on the pump. Now I'm going to take my cassette. I'm going to pop off this blue tab. I'm going to take the pronged feet of my cassette and hook that into the bottom of my pump. Push down on a hard surface, and now I'm going to counterclockwise turn that so it is now straight, and this is locked in place. From here, what I need to do is I need to prime my tubing. All of this tubing is filled with air, and I want it to be filled with medication. So I'm going to make sure all of my clamps are unclamped. There's 2. And I'm going to press and hold the prime key for 3 dashes. That puts it into prime mode. Now I want to take the end of my tubing here, and I'm going to hold the prime key until I see a drop of fluid in this cap. Now this will eventually self-stop itself after it goes through some priming cycles. So you will have to release the prime key and then hold back down until you see this drop. See, it stopped itself, so I need to release, hold down again. Okay, we have a drop in our cap. Perfect. That means all of this tubing now is filled with medication. So at this point, what I would need to do is the patient would have your catheter in your chest. We would clamp the catheter on you. So the clamp that is attached to your catheter, clamp that, disconnect the old extension tubing with the other pump in the old cassette, disconnect that, get an alcohol swab ready, clean the end of your catheter, connect, pop this off here without touching either end, connect that, screw that on there nice and tight, make sure the connection is nice and tight. Now I'm going to follow the 3 clamps, so unclamp your clamp on your catheter, and I'm going to follow it down to make sure all of these are unclamped. 1, 2. So there will be 3 clamps you need to ensure are not clamped. Now, once that's connected to you, we're going to take our pump and we are going to hold the start key until we see those lines disappear. It's going to show us our settings. And we want to make sure that it says run. Perfect. Now we're running. So now we would put this into our little pouch and disconnect the old pump and tubing and cassette, stop that pump, disconnect, and store that one away. Now to stop it, I just want to show you this on this pump. You're going to press and hold the stop key for 3 dashes. And to turn it off, you would hold this again for 3 dashes. And that's it.